Hi everybody, I'm Gina Berman. I am the medical director of the Giving Tree Wellness Centers, which are medical marijuana dispensaries, one in Mesa and one in North Phoenix. And I wanted to start off kind of how I got here. I'm the typical Scottsdale soccer mom, like not the typical demographic to be supporting legalization of marijuana or cannabis. So I started off as an emergency room physician. That's what brought me to Arizona. And I did my residency here in county and moved on to work for 10 years at St. Joe's in the emergency room. Towards the kind of the middle to the end of my career at St. Joe's, there was a growing demographic of patients that were just a real lose-lose situation for both of us that come into the emergency room, and those were the people who were affected by the opiate epidemic. And it became such a challenging patient population to treat because my options at that point with a patient are to either continue to prescribe the opiates and engage in that endless cycle of physical dependence, misuse, or abuse, depending on the patient, which did that patient no good, or to refuse to prescribe opiates to the patient and either send them to another ER or even worse, send them out to the street to get that substance. They were stigmatized, called drug seekers. It was a very challenging patient population to treat. And I saw more and more of that in my practice towards the end. And I was always a fan of alternative therapies. And my business partner and I had thought of putting together a clinic where there would be the options of alternative therapies, such as acupuncture, naturopathy, yoga, massage, meditation, things like that. And these are treatments that will not hurt patients and very likely would help them. And it seemed that the view of our patients was very focused and very myopic on Western therapeutics. And these patients are trapped in this vortex of Western medicine. I thought, well, maybe, and I would recommend in the ER, why don't you try acupuncture? Why don't you try something else? Because this isn't working for you. But this was in 2008, 2009, and the economy was not doing well, and paying out of pocket, as a lot of these providers are not insured or not reimbursed by insurance. It really wasn't a workable business plan. It wasn't a business that would ever function on its own. So then I was driving home from work one day in 2010, and I heard Andrew Myers on NPR talking about Prop 203. And right after the segment, I called my business partner and I said, look, I know how we can do this now. We can go for a medical marijuana clinic. We'll have a patient demographic that has chronic pain that's looking for alternative therapies, and we can use the nonprofit basis of it to really fund the alternative therapies. And the Giving Tree was born. And that's how we started, not knowing anything really about the research. I learned so much, not knowing really anything about the plants. I wasn't a consumer. I really have learned so much, but that was how that was how that door opened for me. And that's what we did when we opened. Is we had practitioners who would come in, and our only request from them was to make their prices as low as possible so that our patients could try it without a financial burden. We took no percentage of their fee. We didn't charge them rent, and this was how we ran the Giving Tree until we ran into issues with the Department of Health. We didn't want those services to be offered. But that's a side note. So I went into it from this kind of medical perspective of encouraging a broader view of medical care, especially therapies that are not harmful. And as I came into the industry and really got to learn about patients, two things I learned a lot, but among them two things were, one is the social injustice of cannabis prohibition, which became very clear to me when I saw people who had been either get marks on their records or have to deal with the legal system because of even small use of cannabis use. And it seemed to me that it was disproportionately, these consequences were disproportionately levied against minorities. And I think the research bears that out too. The other thing that I learned was a lot of the patients that came into the dispensary were similar patients, a similar story to the patients I was seeing in the emergency room. And now they had an opportunity, and they had another option for treating either opiate dependence and getting off of opiates, and patients use it for other things too, such as benzodiazepines and some some psychiatric medicines, especially for depression. So I saw a lot of patients deviating from traditional pharmaceuticals and having success with cannabis. Some did not have success, but there were some patients that were having success with it. And this led me to get my board certification in addiction medicine, and we're opening an opiate harm reduction clinic in January called Blue Door. So it's led me into that realm. But now as to why I support legalization, so the medical part is all great, but there are 4 main reasons that I support legalization. Number one, piggybacks off of the medical issue, and that is that the Department of Health right now is lords over what patients qualify to get a card. There are a lot of medical conditions for which cannabis is worth a try, that it's not going to be harmful, that patients still don't have access to. And I'll give you an example. I had a mother call me, and she said her son is addicted to heroin. She wants to use medical cannabis to get off of heroin, which makes all the sense in the world. I can go into the neuropharmacology of it. I'll spare you, but if you'd like to know, I can explain why it makes all the sense in the world to do that. And I said, does your son have a qualifying condition? No. So this is a mother, I'm a mother, I have 2 little kids, who's trying to save her son's life. And she's trying to do it in a very reasonable way that makes sense. And her child's option right now is to die, or to hopefully find some kind of religious, usually we say people who are addicted to heroin either find Jesus or they die. I mean, this is it's such a devastating illness to be a heroin addict. And I had nothing to offer this mother. And I think that she should have the opportunity, and her son should have the opportunity to use a less harmful substance. And the biggest downside to her son using cannabis is that maybe he will become addicted to cannabis, which in adults is about a 9% incidence of addiction, right? So that's the worst thing that can happen. Right now, that's a whole lot better than what his future is looking like. So I have patients who have insomnia or who have depression or who have a lot of other medical conditions that they have to use another qualifying condition for. This turns very intelligent, capable, upstanding citizens into liars and cheats for no good reason. Adults should be able to make this decision for themselves if they want to use it for a medical benefit. And so for this reason, I think that opening those doors up, giving adults the chance to make this choice for themselves gives self-respect back to the adults of this state. And so I support it for that reason, because there are a lot of medical issues that patients could use it for that make a lot of sense that right now they're prohibited by, because the Department of Health really is not going to release any other qualifying conditions they've made back there. So that's number one. Number two is that it fixes some of the problems with Prop 203, which was really well written. It was such a great start. But there are some issues with the Department of Health is not it's not for compliance. Their mandate is public health. So when there are issues within the program, they really are hand-tied in terms of enforcing the rules. And this has come up time and again. There's been a lot of frustration when I've spoken with the folks in the Department of Health that they really can't do things when there are violations of the administrative code. The other is that, again, you can't add qualifying conditions, and then if you look at outside of the AMMA, there's no real enforcement of the kind of the underground or the black market of cannabis. So there's an enforcement division written into the initiative as it is. So that hopefully will be fixed at least to some degree. I touched upon this a little bit earlier, the social justice aspect of it, which I was completely unaware of until I got into the industry, became much more clear to me. It's really a means, it's like the stop and frisk type of thing. It's really a means to harass minorities. If you see the number of minorities who are arrested for or fined for marijuana offenses compared to Caucasians, when you have similar use rates, it's disproportionate, it's unfair. And then the last is that marijuana use has always existed. It's existed since the first pharmacopoeias that have been written. It's been used for medical purposes. It's been used for religious purposes. And it's a fairly harmless plant. The downsides of cannabis are, again, for adults, about a 9% incidence of addiction. You can have changes in your vital signs, so people with cardiovascular disease should be careful. The overdose is unpleasant, although it's not fatal, it can be unpleasant. So the side effects and the adverse effects are fairly minimal. And so it doesn't make a whole lot of sense of why we are allowing this to be an underground issue. Why not bring it up into the light? Why not decriminalize all the adults who are currently using it? Marijuana is the most commonly used illicit drug in the entire world. So it just makes criminals of adults who are making a smarter decision than if they're going to drink alcohol, to be frank. So why not use it to fund some of the social programs that we need? This initiative focused on schools. So why not give money to our flailing schools and really legitimize adults and give them the ability to make these decisions for themselves? So those are my top 4 reasons for supporting Prop 205. If you guys have any questions, I'd be happy to answer them.